Hi everybody, I'm Catherine Cummerton. I am the ARC East of England's Public Community Involvement, Engagement and Participation Lead, or PCIEP for short. So the overall ARC's remit is to carry out applied research and capacity building. But central to all of this is patient and public involvement throughout our governance, operations and research, all to make an impact, making a difference to services and ultimately patients and the public. So here at the ARC East of England, we're committed to involving patients, service users, carers and members of the public in our health and social care research studies. We want to engage with our communities to make sure they both influence and benefit from the research we undertake. So we have a governance structure with PCIEP advisors and an operational PCIEP lead, which is me. Since ARC East of England launched in 2019, we have set up a PCIEP coordinating group. This group is run by two co-chairs, which is myself, and also Liz Stokes, a public representative. It also has representatives from each of the research themes and also other lay members. The group looks at what PPI is happening in the themes, shares experience and learning in PPI, and also raises ideas for ways in which ARC can support researchers across the region. The PCIEP coordinating group has been working together to develop a strategy for involving patients, carers and the public in all aspects of the ARC East of England's work. As the PCIEP lead, I'll be working collaboratively to develop and deliver different ways to help researchers and patients and public to carry out PPI in research activities in line with our strategy. This strategy is already being implemented. For example, we have lay representatives in groups and committees that oversee the planning and organisation of the ARC East of England to make sure we act in the best interests of our communities. These roles enable patients and public representatives to draw on their lived experience and use their perspective to influence the decisions we make about our work and research. Our researchers in the different themes have been involving patients and the public in the research that they're carrying out. They are also working hard to engage with the people who live in our populations in focus, so that we can understand better what the needs are of those communities and work to make sure our research makes a positive difference to the lives of the people who live there. We try to support our ARC researchers when involving PCIEP members in their research to make it relevant. PCIEP representatives are also included in advisory groups, panels, in partnership with researchers. ARC is working with other PCIEP leads from partner organisations to plan and provide PPI in research training, guidance resources and events which research patients and the public can all benefit from. Working with regional organisations who support our communities helps us to increase the involvement of underrepresented groups, in particular our populations in focus. Within the ARC East of England, we also have a research theme dedicated to finding out the best ways to involve patients, service users and carers and members of the public in research. Evidence produced by this inclusive involvement research theme, you'll get to see their presentation next week on the 26th of March. We'll be using that to make sure we are using PCIEP in the best way. So great work is already being done in realising the ARC PCIEP strategy, but we recognise that there is more needed to achieve our goals. And ultimately, our goals is to establish a model of PCIEP that increases meaningful and effective engagement, involvement and of diverse groups, and enables truly collaborative and co-produced research design and implementation. So we're really going to be focusing on extending research into PCIEP and also extending PCIEP of diverse groups and underrepresented communities. We also want to further increase PCIEP representatives being involved with the research themes, and also making sure PCIEP is on the agenda of governance and theme meetings. We really want to build on and build new relationships in our populations in focus. And we want to ensure that these communities have a role in shaping our research and strategic objectives. And of course, we'll be using the national PI standards to build and monitor our work. So working collaboratively and engaging with communities is really at the heart of the ARC East of England. We are working to engage and involve underrepresented communities in health and social care research and really develop community-led approaches to solve problems. So our populations in focus, as I've mentioned a few times, is Great Yarmouth, Waveney, Peterborough and Fenland, Stevenage and Thurrock. So we also work with ARCs and other NIHR organisations in sharing learning and developing joint approaches to PCIEP. So I wanted to quickly touch on a real world example of this, and that's the Reaching Out project. So the Reaching Out project was originally commissioned by Involve and the Research Design Service back in 2018. And the purpose was to encourage the development of new public involvement and engagement relationships and new or more effective approaches to building relationships within communities. The emphasis was on members of the community who are not usually or consistently involved in health and social care or public health research. The aim was to support new and improved research partnerships and broaden involvement in research. So in fact, Involve has now published a practical guide to being involved in public involvement in health based on the learnings from the Reaching Out project. But I thought it would be much better to hear from Molly Brooke, who is a young partner speaking about her involvement in the Reaching Out project. So now I invite you to watch a recording of a conversation I had with Molly. Thank you very much for listening. Please feel free to leave comments in the chat, and hope you look forward to listening with my conversation with Molly next. Hi, Molly, welcome. Thank you for joining us today for the ARC Showcase event. Could you just start off by telling us a bit about yourself?
Yeah, well, I'm Molly. I'm 27 now, nearly 28. I keep saying 28 by accident, which makes me sound older than I am, because I'm already losing track of my age. I have several conditions, including functional neurological disorder, epilepsy and autism. And I currently live in a care home, but I used to live with my mother as my primary carer.
Okay, thank you. So you've been working or been involved in the Reaching Out project. How did that all start?
Well, it started at the very beginning, really, because I am part of an arts group called YAC, Young Arts Community, run at First Sight by Beth Hull. And I was at one of their sessions. We were just, getting on with the usual activities. And Tracy was invited in. She'd asked to come in. She was invited to, and she came along to that session, and she started talking to us. And I don't even remember the conversation, but Tracy apparently really vividly does. And she says she kind of had a eureka moment when she was talking to me. That's her own words, not mine. A eureka moment where she realised how to run the project. So I was invited to go along to the actual sessions with the Reaching Out project if I wanted to. And so I did.
Lovely, thank you. And so what were your experience of being involved in the project?
It was really positive. It was my first kind of research project that I've ever been involved in. And it was really, really positive. It just started out as a small little kind of project thing in but it actually really blew up and became a major part of my life. Tracy was really good at taking in the information that we gave her. Things like, from my point of view, the accessibility of the venues we used. So the first venue was upstairs, which I really struggled with because of my disabilities. There was no stair lift or lift. So I really struggled with up and down the stairs. I just about managed it, but that was pure luck that I was good on the day. So from then on, we took the actual meetings at first site, where it's all on level ground and it was easily accessible. So she was really good at taking in the information and also giving us a bit of a free rein in order to unleash our creativity and get what we wanted out of the project, as well as giving her what she wanted.
Yeah, sure.